everyone, my name is Rajayla, and today I'm going to be trying to convince you about why you should support healthcare reform. Let's talk about a man named Gary. Gary is a middle-aged man, married with no children, and he just recently lost his job that offered him health insurance. On his way home from the gas station one day, he swerves to avoid hitting something and overcorrects, and he has a car accident. He's fine. He has a few cuts and scrapes, and he's taken to the hospital. He's given a breathalyzer, and doctors run a few tests that are a little bit unnecessary. He fills out lots of paperwork, leaves the hospital, and a few months later gets a bill. This bill is around $15,000. This is a problem Americans are facing every day. Sky-high health insurance rates drives people away from doctor care, suffering, or turning to illegal drugs to ease the pain. So we obviously need some type of healthcare reform. And as everyone I'm sure knows, we are trying to move to a universal healthcare system, but there are a few reasons that that's not working right now. One of our first reasons is that it's just too expensive. There are a few reasons why it's so expensive in the United States that most people don't think about. The first one is actually because of administrative costs. Any medical center you might visit has an obviously large number of workers that are doing paperwork basically. All they do is shuffle paperwork, try to figure out how to make you pay more money, and bill insurance companies. And we pay them about $90 million more than we expect a year. The second reason is that Americans spend more on healthcare and drugs in general. Typically, name brand drugs cost more in America than they do in other countries. The drug Lipitor costs you about $124 a month in the United States compared to a whopping $7 in New Zealand. Doctors are also terrified of malpractice suits, so they run every single possible test and give you every single medicine that they possibly can to keep you from suing them. And medical supply companies often charge more for these supplies, meaning that you're paying a lot more than you think for these unnecessary tests and drugs. The third reason that healthcare is so expensive is that America does not participate in negotiation as part of inpatient and outpatient healthcare. Instead of fueling competition by going from manufacturer to manufacturer to find who's going to offer us the lowest price, we just pick one. Until our government is able to negotiate on prices of materials and other supplies like that, our spending will continue to be greater than other countries. According to Harvard's lead doctor, Dr. David Cutler, the prices would be significantly lowered if health insurance companies cover what doctors mandated is responsible for keeping people healthy, and left the rest to the consumer. Any optional treatments will be charged to you instead of the government health care plan. An estimated 44 million Americans are uninsured, but whenever those Americans have life-threatening diseases or injuries, we still have to pay for them to get treatment, obviously. By giving everyone minimal health care options and making sure that everyone is insured, we could save an estimated $49 billion a year. If healthcare reform interests you, here's what you can do to help. You need to look for insurance companies that offer price comparisons. Something as simple as being able to log online and check the prices of whatever procedure you need could exponentially lower prices. You could then pick the one that you wanted to go with depending on how much you wanted to pay. This cuts down on the unnecessary tests doctors need to protect themselves and the overpriced equipment they use. For example, if Sally needs a hip replacement, she can log on to her insurance company's website, find all the doctors that are eligible to give her that hip replacement, and pick the procedure. If the doctors mandate that the hip replacement will cost $12,000, Sally's insurance company is only responsible for $12,000. If Sally wants to go with Dr. B, who charges her $18,000, Sally is responsible for paying that extra $6,000 herself. This in turn cuts down on the amount that Americans have to pay for this health insurance. It seems a little wrong to make consumers pay for that, and for selfish reasons, who wants to pay that extra money, right? But it's easy to justify those costs whenever you're talking about bringing down the healthcare spending of America by billions of dollars. And it might seem like an unnecessary task, like who wants to do all that research, but it can save everyone a lot of money in the long run. You can consult with your insurance company, shop around, and write to your senators and representatives telling them that you support reform of our healthcare system. Obviously, like I said, there's no one reason to blame. There's lots of different factors that factor into why it's so expensive. But healthcare reform is sure to take some time, but if everyone gets together and expresses interest in this, the change will be for our best. If you want more information, you can log on to counseling.org for resources and links about healthcare topics and what exactly you can do to help that. That's it. Thank you.
Very good.